Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
In our previous segments, we talked about the first thoracic vertebrae. Today, we're going to identify the second thoracic vertebrae and its partner below, the third thoracic vertebrae. Our spine is broken down for general discussion into three sections: the neck, called the cervical spine, the mid-back, which could be called thoracic or dorsal, and later in our other segments, the lumbar spine. What's unique around the thoracic spine, however, is the fact that the ribs join to these vertebrae. And when we have problems associated in the upper area around what we said last week was T1, and here T2, and the next one T3, the connection with the ribs and the nerves start to have an effect. So what are the signs and symptoms that may be telling you you're having a back problem? Most commonly, remember, you don't feel the vertebrae. So it's very important in understanding your back and both diagnosis and treatment that the information has to be aware of something you don't feel as well as the things you do. So what do you feel? In most cases, you're going to find that slowly you're aware of some sore muscles. In and around the area we're talking about today, T2, those will be the neck, shoulder, upper back muscles, different muscles, there's 5 layers, so you're going to have different feelings of muscle pain. The fact, however, you're feeling muscle pain either on one side and at one level are the first indicators, along with some problem of motion. Remember, our back is all about mechanical movement, so if a problem occurs involving 3 vertebrae, then that movement in those vertebrae is going to reduce. Now, don't forget, we said that the ribs join in to this level and all of the 12 vertebrae that make up that thoracic or dorsal. So what can happen in a problem involving that area is your rib movement may also be affected to let your lungs fill up with air. Breathing's kind of important. And your body's going to want to breathe more than avoiding pain associated with the movement of those ribs. Sometimes this can be so intense that the pain radiating around the rib cage can feel like a sudden spasm or a heart attack. Well, if you're afraid that that's happened, by all means get to emergency, make sure you don't have a heart attack. But once you've been cleared of any of that, or if it's not that severe, remember to call your family chiropractor, get that consultation, and identify if that muscle, that stiffness, and that pain that comes around that rib is part of the syndrome or complex in those vertebrae. Exercise is critical. Whether it's the neck, the mid, or the lower back, it's all about movement, it's all about function. Our next segment next week is going to feature Dr. Ken. He's been to the Olympics 6 times, involved with athletes and training. Remember, your back is important to your daily health. Join us on the next show as we continue our journey down your spine.